CNA Practice Test 2025, 100 questions to pass. Question 1. You are caring for Thomas N. Thomas is 77 years old. He has edema, or swelling, in his legs and he has a fluid restriction in terms of his fluid intake. You have been assigned to weigh him daily. Based on these symptoms and the care that he is being given, what disorder is he most likely affected with? Option A, diabetes. Option B, dementia. Option C, congestive heart failure. Option D, contiguous heart disease. The correct answer is option C, congestive heart failure. The patient has the symptoms and care indicative of congestive heart failure, not dementia or diabetes. People with congestive heart failure, CHF, have dependent edema of the legs. They have too much volume in their blood, so the person will have a fluid intake restriction and a low-salt diet. The person will also get daily weights to determine how much water weight the person is gaining or losing each day. Diabetes and dementia would not present with edema be required to have a fluid restriction or low-salt diet. Diabetes has to do with blood sugar regulation, and dementia is a neurological disorder. Contiguous heart disease is not a disease. Question 2. You are caring for a diabetic patient who reports dizziness and is shaky and sweaty. The patient is alert and oriented. The patient's vital signs were normal 1 hour ago. After reporting your findings to the nurse, what do you expect the nurse to ask you to do? Option A, take the patient's blood sugar. Option B, take the patient's vital signs. Option C, call a rapid response or code. Option D, answer the call light of a patient who is requesting a walk. The correct answer is option A, take the patient's blood sugar. This is a diabetic patient who is presenting with symptoms of a low blood sugar, a common finding in diabetic patients in the hospital. The nurse will most likely request you to take the patient's blood sugar. The patient's vital signs were normal 1 hour ago and he is presenting with signs of low blood sugar, sweating, tremors, and dizziness. While a rapid response or code would be appropriate if the patient was unresponsive, this patient is alert and oriented. The nurse will most likely ask you to check the patient's blood sugar and assist with any other tasks related to this patient who is symptomatic, prior to answering the call light of another stable patient. Question 3. You are assisting an elderly female patient to the bathroom. Which of the following would be important to emphasize to the patient to prevent urinary tract infections? Option A, wipe from front to back. Option B, stand up slowly to prevent dizziness. Option C, make sure to press the call light when you are done. Option D, put one hand on the walker and one hand on the seat to press yourself up. The correct answer is option A, wipe from front to back. Making sure the patient wipes from front to back is important to emphasize to prevent bacteria from traveling from the anus to the urethra. Instructing the patient to stand up slowly will prevent orthostatic hypotension and potential falls. Making sure the patient presses the call light will be important in patients that are weak and at risk for falls. Helping the patient use proper body mechanics when standing will help to prevent strained muscles and improve movement.